says.
Did you want the music in the background of the Reichel?
Yeah, it's fine. We usually listen to music during procedures, so we might as well have it. Good thing you're nice and tall, Elle.
Today.
Do a good job with the camera. How you doing, Mary?
Okay.
Is it hurting?
No, it's just funny pressure.
Yeah. Okay, go ahead and turn your head a little bit stretching for me. Good job. These are over. You've got a tiny little neck.
I know. And now it's going to be tinier.
Now it's going to be tinier, that's right. Cannulas to this one. It's easier to handle. Are you catching all the exciting moments? That's shaping Mary's neck.
Zoom in a little bit there.
This is my smart hand making sure that the cannula, I know where it's at all times. Here you can zoom in on a cannula, showing that it's a little cannula with two little holes on the end where the fat, then it's attached to a suction tube. And the fat is sucked through the little hole there. Mary, go, oh, oh, good. That was me checking for nerve function. You can see already that she's getting real flat on this side. Mary, you've got one of those little veins too that comes up here.
I know.
Ooh, we have to see how that sclerotherapy went, and then we do yours. Now I'm going to switch over to the other side. I'm going to the other little port here. You can see squeezing that compared to squeezing this, how little fat there is over there compared to this side. Are you feeling pretty comfortable?
Yeah.
Good. Here, I'll turn this so I'm not smacking you in the face. We're jamming out. Did you change the music?
Mm-hmm.
Yeah. I was like, this sounds more like Mary's music.
Katie's going to this concert tonight, so we decided.
Oh, is she really? Awesome. Katie.
I wanted to go see Dead Can Dance tonight.
Yeah.
But no. I was going to go camping.
Oh.
But we got our pool heater
That's working, so now you're going to cool it.
Yeah. She's like, I can't be away from my pool. I must play.
No hot spots so far.
That's good.
Mm-hmm.
You look very good and numb.
Yeah, so before doing the liposuction, we use these same little portholes and we infuse saline, which you can see over there, into the same areas. And it's got has lidocaine in it, so that it numbs up the whole area. Mary's just taken a little bit of Valium for this procedure, and is very comfortable, as you can see.
Looking beautiful, Mary.
I'm going to turn to this right here.
You can see the sheet up there, Al.
I don't think they've had it down.
Doing okay?
Yep.
You want a chair?
No, I'm okay. Do I look like I'm contorted?
Good grief.
I don't feel jittery at all from like back here or anything.
You don't?
Mhm.
Yeah, good. Well, it's pretty low concentration.
Mm-hmm.
Doing awesome.
Probably 100.
Oh,
I'm hungry.
you're a model patient, Mary. Honestly, you're not making a peep.
And Mary go, oh.
Oh,
When's Joe coming? When did you
I'm
call?
gonna call.
Okay.
You're checking along the cannula there.
Yeah, I'm checking along the cannula to see if there's any fat left. So you can see there's some right there. So I'll go in with one of the smaller cannulas right here. That's an area that you really have to concentrate on, especially in Mary, because that's where really all her problem lies. And then you can see out here, there's really not much in the way of fat left. And these X's are to mark off that nerve that we want to be careful with.
What's that?
Just a smaller little cannula. Always keeping these towards the down towards the tissues, not up towards the skin ever.
We get a little blood pressure or anything, Mary?
Mm-hmm.
Oh.
It's 110/80.
Mm-hmm.
So we've been going for about 15 minutes now, and we're almost done.
Oh, I'm sorry.
Definitely got out a little more there.
Mm-hmm.
Starting to make the liposuction sound.
Sound of success.
Sound of success. Slurp, slurp, slurp.
So what are the chances of this coming back, Dr. Reichel?
Well, if you gain a lot of weight, then you may gain some of this back.
And if I maintain,
then it shouldn't come back.
yeah.
Yeah, I mean, lifetime with the thin jaw. Were we thinking of doing the old therapy?
That's what the plan
Just
So-
in the numb zone.
Okay. That's up to you, Mary, if you want to do it on a different day, or if you want to do it now, it's fine with me.
is. It's a cute jacket and like.
Very good.
Oh, yeah, I think I have one of those. So you can see when I did a pinch test now, where I was pinching over an inch, I'm now pinching just a teeny bit. I've got to get down a little bit down here. So I think I'll probably do from the foot over here. Turn it a little that way, Mary. There we go. Hi, Katie.
How's it going?
It's going great.
How you doing, Mary?
Good.
Are you liking the Cascade Station? Yeah, this is really good. The sound
Are you going to
effects
see
are-
Cascade?
I was telling you,
Where
my
at?
sister got me tickets, so I got
Where?
at Guamu, so I have to get pumped up for tonight.
Oh
I
my
know.
gosh.
I'm terrified because it's 16 and over. So I
Yeah,
can
be
only
terrified.
imagine.
Be terrified. Very terrified.
Fun.
I actually have had dinner with Cascade
Really?
and his wife a couple of different times.
Sitting with them in
That's
Vegas,
nice.
and I was telling Mary, since my little sister Sydney, she's pretty good friends with his manager now,
Yeah.
and they live down in California, and so she called me and she's like, Jared, put you +1 on the list. You have to go on Friday. It's like, oh, I can't wait.
Cute.
Nothing I'd rather do.
So funny. He's actually a really cool guy.
That's what I've heard.
Super cool.
I've heard they're
He's
all
really,
just so
he's
nice.
really
and down to
nice and down to earth. And he
And-
doesn't even really drink.
And Sid said the wife isn't like anything too special, just normal.
No, she's
really
super normal.
average,
She's really nice.
Yeah.
Super nice. Yeah.
Huh. He must just fly in really quick, do a show, fly home.
Yeah. But good for them. It's like awesome. Okay, we're just gonna go right back here for just a second.
Did you have dinner with him here?
Yeah, here in Seattle.
Did he come here a lot?
Yeah. Some of my friends are good friends with them.
Where's he from originally?
They're from Cal. I don't know where he's from. I know they live in the Bay Area. I think he must be somewhere.
He's sure just blown up.
Back when we were like watching him at the Baltic Room, Mary.
Oh, that's amazing.
Is he from Seattle?
What's that?
Is he from Seattle?
Okay, little lady.
What do you think?
Lift your head up just a tiny bit for me. Certainly isn't much to pinch there. Okay, go back for me.
Oh, did I just miss you?
That's it.
I was calling and everyone wants to get her prescriptions tomorrow or something. I called in that night and sent her what I was in.
So this is what we fill out.
Okay.
And if there were more areas, we would keep that paper bag and do it.
Let's go.
Why am I doing this one?
Doing great,
It's not
Mary.
quite set up
Oh,
over
okay.
there. You know, the grid is just not working. There are these numbers, it's just not working yet.
Okay.
So what you have to say is where the area and what cannulas you use, she used. And I should have written Stallion 2 at,
All done.
2:30.